Hi team, thank you very much for joining. So I think we are having like 30 people today. That's great. So can you kindly put in the chat box your name and where are you from? I think some new people also there.
Not here.
Can you kindly put in the chat box your name and where are you from? Kindly put your name and where are you from?
My daughter was asking that. I'm going out today. A lot. Yeah. Oh.
Yes, team. Kindly put your name and where are you from? Team, can you kindly put your name and where are you from? We are having 36 people and only 6 or 7 people have replied. So SB Lama from Nepal and Yusuf from Malaysia, Abhinaya from Erode, Sijisha Kerala, Vimala Tamil Nadu, Ikran Majid Kashmir, Chhattisgarh, Dr. Kiran Shivamoga, Kerala, Pushpa from Rohtak. Okay, I think these are the people who are mentally present in the chat box. Samir from Nepal. So we are having international clients here. Thank you very much for joining. Today we are going to see case study, step-by-step case study with relation to OCD, and if you have time, PTSD. Let us start with OCD. Before that, this is a side talk. Side talk is psychology talk. We do every Sunday at 9 p.m. Every Sunday at 9 p.m. we do it. So shall we start today with a mindfulness exercise? Rupika, Ashwini.
Yes, sir.
Rupika, can you do a 1 minute mindfulness?
Yes, sir.
Yeah, keep your mic a little bit closer. If possible, come on the video. Please come on the video. I made you co-host. Rupika, I made you co-host. And I am muting everyone. You can open your, unmute yourself. Yeah. Yeah, please go ahead.
Close your eyes. Hands on your thighs. Sit straight. Slowly breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Feel the oxygen all over your head. Breathe out. Breathe in. Feel the oxygen all over your head. Breathe out. Breathe in. Feel the oxygen all over your head. Breathe out. Breathe in. Breathe out. Breathe in. Feel the oxygen all over your body. Breathe out. Breathe in. Feel the oxygen all over your body. Breathe out. Breathe in. Feel the oxygen all over your body. Breathe out. Breathe in. Breathe out. Your mind is calm. Your body is relaxed. Your mind is calm. Your body is relaxed. Your mind is calm. Your body is relaxed. Now slowly open your eyes.
Thank you very much, Rubika. Thank you very much. So, Rubika is doing, Rubika, you are doing second year or third year?
Third year, sir.
Third year, yeah.
Yes,
So she is doing BSc third year. It was very nice, Rubika. Acha. So, and now we will start the session. Okay. First, let us try to understand what is OCD. Okay. So, I am opening the mic. I'm opening the mic. I'm opening the mic. So, can anybody tell what is OCD?
Sir, OCD is psychological disorders and it can be separated into obsessive disorders and compulsive disorders. And obsessive disorders is like when they are obsessed with something but they don't want to do. Like if they go into some places, they'll continuously think about that, but in compulsive disorder, they want to touch it and do it again and again. So this mixture of these type of disorders is called as obsessive compulsive disorders, and it also differs according whether it's psychosis or neurosis too.
Very nice. So, so that was very nice. Okay. Can anybody tell the OCD cycle? What is OCD cycle? What is OCD cycle? OCD cycle. OCD cycle is, I have put it in the chat box. First, the obsession comes. For example, today we are going to see the case study about a girl. She is 21 years old. Now she is she was well till the corona period. After corona, her behavior changed. That is, she used to wash her hands too much, and she has become extra vigilant. She will not touch anyone. She will not touch any. She will be going to the college. Okay, she will be wearing the gloves. Okay, the moment she comes from the house, she will throw it. She will throw it in the dustbin. Without this, she will not go anywhere. She will not touch anybody, including her parents. Even if the mother touches, immediately she will go and either take bath or she will apply the repellent creams or something. Okay, so she has become extra vigilant. Now the thing is, the parents started understanding that, okay, this is interfering, this particular behavior, interfering with their behavior. Okay, now the girl is in second year, she's doing second year BSc mathematics. Even from the college, they started getting complaints about her behavior. So they thought that, okay, let us go to a doctor, and they visited a psychiatrist, and then they came for counseling. Okay, so the OCD cycle is first obsession, the obsession that becomes an anxiety, the anxiety then obsession and anxiety combining, it becomes a compulsion. When during the compulsion period, they will do it. Suppose, for example, they feel like washing, they will wash it. That is the compulsion. The moment they do it, they get a temporary relief. They get temporary relief. Then again the obsession returns. So obsession, anxiety, compulsion, temporary relief, and obsession returns. So for OCD, which therapy model is best? Justin,
CBT.
Cognitive
CBT
behavior
is
therapy,
best. Yes,
exposure therapy, exposure therapy,
yes. CBT is best. Then
therapy.
so we can use CBT. We can use REBT also, and we can use hypnotherapy also. So it is better to understand the technical aspects. Obsessions are unwanted, intrusive thoughts, images, or urges that repeatedly enter the person's mind and cause distress, anxiety, and or discomfort. For example, washing the hands. My hand is full of germs. The obsession is my hand is full of germs. So that is an unwanted one that intrudes the brain. Okay, the thought. They may start getting images as if there is germs all over their hands. Okay, and they may get an urge. They may get an urge that is a compulsion to wash their hands. Now, these all are the acts. It is involuntary and it will come persistently and repetitive. Mostly it is disturbing and distressing. So compulsions, on the other hand, compulsions are a repetitive behavior of mental acts. So it is repetitive. Compulsions are the repetitive mental acts, and these mental acts, acts that a person feels, it drives them to perform in certain way in response to an obsession in order to reduce the anxiety or prevent a feared event. For example, washing the hands, excessive hand washing the hand in response to a contamination of, in response to contamination fear. So obsession, compulsion. And the obsession creates anxiety. The anxiety creates obsession and anxiety creates compulsion. That creates, when the compulsion is acted out, that gives a temporary relief. That gives a temporary relief. Then again, the obsession returns. Now let us see the complete case study and also how we can do the interventions. Completely we can see. So what is the assessment which is being used for OCD?
DSM-5.
DSM-5, we will use it for DSM, we may be using for everything. Particular assessment, which assessment we will be doing?
Y box.
For example, we have a big depression scale. We have anxiety scale. Like that, we are having one scale, and this is a scale. This is what we will be using. Mostly this is used. Once again, I'm showing. So we will be using this to check the YB obsessive compulsive scale. That is called Y box. YL Brown obsessive compulsive scale. So client name and date. Okay. So question 1 to 5 are about the obsessive thought. So time occupied by obsessive thoughts, interference due to obsessive thoughts, distress associated with obsessive thoughts, resistance against obsession, degree or control over obsessive thoughts, either complete control or no control. Time spent performing compulsive disorders, interference due to compulsive behaviors, and distress associated with compulsive behavior, resistance against compulsion. So we have to write the score here. Degree of control over compulsive behavior. Then we write here the total score. The higher the number, the higher the presence of the obsessions. Higher the score. Now then, this is symptom checklist. In symptom checklist also we will either if it is suppose I am having it now and also I had it in past. So here we will tick both. Okay. So this one will try to understand what are the symptoms. Okay. What are the compulsions we have? Compulsions and obsessions we have. Okay. So this is usually it is used. Now we will go to the case study. Okay. Now, can you people put in the chat box? Okay. I will ask. I will put certain questions on the chat box. Okay. I want you to answer for those questions. Okay. Once again. Okay, here goes the first question. So please come to the chat box. Please come to the chat box. The first question, which of the following is an example of an obsession in OCD? Please answer. Please answer, team.
C.
C is the correct answer. Yes. Others? C is the correct answer. A is not the answer because A is the compulsion. That is not an obsession. Repeated hand washing happens. First, you have the obsession. The obsession is a persistent fear of contamination. In response to this C, A happens. Okay. And it is not all also. So C is the answer. Okay. So this is to understand how much we are able to understand. So that case study also we may be able to do it very nicely. Now, second question. Second question. What is the primary purpose of compulsions in OCD? Yeah, Lama, I will be sharing the complete case study, everything.
C. To reduce anxiety caused by obsessions.
Psycho-nazar. Very nice. So people say it is C. Others, kindly put it. Don't say just because everybody says something. In Kaun Banega Crorepati, everybody chosen something. Okay, but that was wrong. Okay, so don't go with the crowd. You see and check and answer. Okay, so my voice is audible, isn't it? My voice is audible?
Yes, sir.
Yes, sir.
Okay, so C is the correct answer. C is the correct answer because as told by Saika, okay, what is the primary purpose of compulsion? See the cycle. I told about the cycle. The cycle is First obsession comes, then anxiety, compulsion. Compulsion is done because to get the relief, temporary relief. So which of the following is the example of obsession in OCD? First question. And what is the primary purpose of compulsion? To reduce anxiety caused by the obsession. That is the answer. Okay. Now, the last question. Okay, the last question. Okay, just 2 more questions to understand your aspect. Okay, which assessment tool is most commonly used to measure the severity of OCD symptoms?
Y box.
B, sir.
Yeah. Very nice. Okay. Now comes the next one.
Sir, just for confirmation, I'm asking, Beck's
Yeah.
box is that Aaron Beck's thing is right, sir?
No.
That's Beck thing.
Brown obsessive compulsive scheme. Why
No,
box?
not that, sir, not that. I'm asking actually, is that Beck depression inventory is found by Aaron Beck, sir?
Yes.
Ah, okay. Just for confirmation, that's
Yeah.
it, sir.
Right. Okay. So next question. Which of the following is not a typical type of OCD symptom?
Auditory hallucinations.
Super. Saika, great. Saika, where are you from?
Kashmir.
Kashmir. Wow. You are thorough with OCD, yeah?
Yes.
Sir,
you,
auditory comes under the positive effects of dissociation, I guess.
which one?
OCD comes under the positive effects of the dissociative disorder, I guess. No, schizophrenia.
No. Okay, let us not go away from the topic. Okay.
Okay, sir.
Now the last question. Okay. So that was C, auditory hallucinations. That is not the OCD symptom. Now the last one. What is the first line psychotherapy approach for treating OCD? First line. And B is the correct answer. CBT with exposure and response prevention. ERP. So that is what we are going to use in this present case also. Okay. So we will start filling up the case study. So team, we have created a separate case study module. Okay. So in EmoCare website, if you go inside, you have case studies. So under case studies, when you go to case studies, to create your own case study or download case studies, click this link. So first we will be adding the client details. Then we will be adding the detail about the clients. Now, name of the client, usually we don't write the original name. Okay. Here I am writing a name, Priya. And to know that, okay, for which one this particular case study we are using, just I am writing OCD. Okay. Her age was 21. Okay. Phone number, and just I am giving my phone number. Okay. And socio-economic classes, she is upper middle class. And she is living in urban. And referral details are referred by self. Marital status, she is unmarried. Gender, female. Occupation, she is a student. And education, she is doing second year BSc. Religion, Hindu. Mother tongue, Malayalam. The mode of counseling, it was done offline. And it is done at the Ambattur branch. Okay, submit. Form submitted successfully. Case studies. And to create your own case study, download this. Acha, okay. Now go to click here. Priya OCD. Okay. Add details. We'll be going to add details. Add details. So Priya OCD 21. All the details have come. And the probable issue of the client. Okay. And now tell me, team, what is the probable issue of the client? Yes, team, can you tell? What is the issue?
OC symptoms.
After corona, she feels
Washing of her hands, sir, and she's always felt feeling that germs are in her hands. Like
Yeah, that is correct. So that is correct. So here we will be write a short, very short description of the issue. A short description. After corona, the client started taking
OC symptoms.
too much care in fear of contamination of hands due to germs, and in the course of time it has developed into a severe habit and started interfering in a day-to-day activities, and the family started getting reports of her behavior from college management. The family went to a psychiatrist, and he gave tablets and referred for counseling. Okay. Now complete client details. So here the presenting complaints that we will write it what do you call in depth. In depth we will write it. So here due to time aspect, because we know about this I am not filling it up now. Okay. So duration of the problem, it started during corona. Now it is on it is 2+ years. Okay, 2+ years it is happening. Mode of onset, how that the problem starts. It is we are having abrupt, acute, subacute, insidious. Team OCD, suppose one who is having 2+ years. Which one will be the proper answer?
acute.
Yes, team, please put it in the chat box. Please put it in the chat box. Team, please put in the chat box. Just make a guess. That is yes, chat.
So what is insidious?
Yeah, actually, one of the aspect is Rahul Karthik, insidious. That is correct. 1 second. Team, is it visible? Is it visible?
Yes, sir.
Team, is it visible? Yeah. So, insidious means something bothering the most. That is some. It is continuously. It is. It is. They have that feeling, and it troubles them a lot. Insidious. Course type, that is continuous. Progressive. Nature, whether it is a progressive, a static, improving, not able to identify. It is progressive. Precipitating factors. Okay. So precipitating factor will be multiple causes. Okay. Multiple causes means wherever she goes, wherever people touch, she starts feeling it. So precipitating factors, wherever she gets in contact with others or others touch. Predisposing factor, it is not genetic, and now her personality is becoming like that. So it is not genetic. History of presenting illness, a short note. So she is having for 2+ years. Parents were not able to identify in the beginning. They thought it is normal. Only after the college also complained, they started taking it seriously. Social functioning impaired. Because of this, she is not attending any functions. When the family is having some marriage functions, etc., she used to tell, I don't come, I will not come. And even for relations, wherein the family must go, because of her, some problem will come, but finally she will not. Occupational functioning. Here, occupational means she is a student. Even there, it is impaired. She is not having any medical history of diabetes, hypertension, or thyroid. She is not having. None. Psychotic history. She is not having any psychotic history in the past. So what we can do is, we can just click this, not applicable. So family history, it is a nuclear family. So not yet married. She is not yet married. Expressed emotions. That is criticality. So she is not very happily mingling with others. Psychotic illness in family, no. So this is not applicable. If yes, who are suffering from it? Birth and development, in this case, it is not required. Wherever birth and development details required, then in the case study, we have to fill it up. So what we have to do is, we have to check whether the prenatal, whether it is eventful or not eventful, whether it is full-term or premature baby, the birth weight, and birth cry was there or not, whether any complication was there. If there is any complication, what is the complication? And postnatal, whether it is eventful or not eventful. Was there any major illness? If major illness is there, what is it? Immunization schedule, whether it is completed or not completed. Completed. Developmental milestones, whether it is normal or delayed. Normal. Major physical illness during childhood. No. Psychological problems during childhood. So there was no problem. Only she was having little bit of separation anxiety. Psychological problems during adolescence. So a little bit nowadays using mobile phone more. Problems encountered during childhood and adolescence, nothing. home atmosphere, it is satisfactory. Home atmosphere during childhood, satisfactory. Home atmosphere during adolescence, satisfactory. Parental lack, no. They have taken care of her well. This is parental lock details, not applicable. So educational history. So Tim, once again. Okay. Tim, once again. Can anybody read this? These details we will fill up. Then mental status examination. After mental status examination, intervention. What kind of intervention we will be giving? Interventions day 1, day 2, day 3, day 4. I am just showing the aspects. Can anybody read this? Tim, can anybody read this?
I can.
Yeah, please read.
Session 1, Introduction to CBT, Psychoeducation and Cognitive Restructuring. In the first session, the focus is on building rapport and introducing the client to CBT model as it applies to OCD. Begin with psychoeducation to help the client understand the OCD cycle, how intrusive obsession lead to anxiety, which then triggers compulsive behaviors providing only temporary relief. Explain how the cycle reinforces OCD over time using cognitive restructuring techniques. Guide the client through identifying automatic negative thoughts, such as I don't wash my hands, I'll get sick or infect others. Engage in Socratic dialogue to gently challenge these thoughts by asking questions like, "What evidence do you have for this belief?" Or how often have you actually fallen ill when skipping one hand wash? Introduce the thought record sheet to help the client document daily triggers, associated thoughts, emotions, behaviors, and healthier alternative thoughts. For homework, instruct the client to maintain a thought diary throughout the week, noting each instance of hand washing along with the thoughts and emotions that accompanied it. This helps in creating awareness and prepares for further cognitive work in the upcoming session. Session 2. Sir, it stopped, I guess. Sir, hello? Sir? Sir? Hello?
Sir, may be disconnected. Shakshi, can you hear me?
Yes, yes, ma'am. I'm there.
Maybe sir is disconnected.
Yes.
Can you connect Fatma ji? Sakshi.
Kindly wait,
Hi,
team.
hi, good evening, everyone.
Kindly wait, team. I'll call sir and I'll let you know what is the problem. Preeti
Yeah,
here.
yeah,
I'll call sir and I'll let you know.
yeah, Preeti ma'am, hold on. Hello, team, is it audible?
Yes,
Yes,
ma'am.
Okay.
yes, ma'am.
Actually, yeah, some network problem is
Team,
from
sorry,
sir
excuse me,
end.
sorry, there is some
No,
technical
sorry
glitch
there,
here.
sorry there.
Fatma ma'am, I've joined. Hi,
Okay, sir.
team. Team, there seems to be some technical glitch in my side. Okay. Please stay there for 2 minutes. I am attending to it. Please stay for 2 minutes.
Sure, sir, sure.
Meanwhile, people can discuss. Sakshi,
Yes, sir.
can you give a systematic relaxation to clients?
Yes, sir.
Yeah, team. Now Sakshi will be giving you a systematic relaxation exercise. Okay, kindly do this. I am attending to the issues.
Yeah. Hello, team. I'm Sakshi, and we are going to conduct a systematic relaxation exercise. For that, just a few instructions I would like to give that every time I say squeeze in, you have to breathe in, and squeeze out means you have to breathe out. So, yeah, we will sit. Um, close your eyes. Sit in a comfortable position. Close your eyes. Place hands on your thighs. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Imagine oxygen flowing over your head. Breathe out. Breathe in. Imagine oxygen flowing into your head. Breathe out. Breathe in. Imagine oxygen flowing into your head. Breathe out. Breathe in. Imagine oxygen flowing in your body. Breathe out. Breathe in. Imagine oxygen flowing into your body. Breathe out. Breathe in. Squeeze your feet. Your feet is relaxed. Your feet is relaxed. Now, gently put your awareness to the calf muscles. Breathe in. Squeeze in your calf muscles. Squeeze out. Your calf muscles are relaxed. Your calf muscles are relaxed. Put your awareness in your thighs. Breathe in. Squeeze in your thighs. Squeeze out. Your thighs are relaxed. Your thighs are relaxed. Now, put your awareness in your stomach. Breathe in. Squeeze in your stomach. Squeeze out. Your stomach is relaxed. Your stomach is relaxed. Put your awareness on your chest. Breathe in. Squeeze in your chest. Squeeze out. Your chest is relaxed. Your chest is relaxed. Put your awareness on your neck. Breathe in. Squeeze in your neck. Squeeze out. Your neck is relaxed. Your neck is relaxed. Now gently put your awareness on your arms. Breathe in. Squeeze in your arms. Squeeze out. Your arms are relaxed. Your arms are relaxed. Now put your awareness on your fingers. Breathe in. Squeeze in your fingers. Squeeze out. Your fingers are relaxed. Your fingers are relaxed. Now put your awareness on your face. Breathe in. Your face is relaxed. Your face is relaxed. Put your awareness on your forehead. Squeeze in. Squeeze out. Your forehead is relaxed. Your forehead is relaxed. Now, whenever you are ready, please gently rub your hands and put it on your face. Open your eyes with a gentle smile. Sir, I conducted the systematic relaxation exercise.
Yeah, thank you very much. Actually, there is a temporary glitch, so I'm very sorry for it. Acha, okay. So we will proceed with the thing. Just 1 second. Okay. 1 second. Team, the view is gallery view or how it is visible to you people? The gallery is whether you are able to see everybody? Team?
Sir, we could see you.
Yeah. You can see me now?
Yes, sir, we could see you.
Acha, okay, thank you. Because still there seems to be some trouble. Acha, okay. Share screen. One second. So add details. So whether the add details is visible to all of you?
Yes.
Is it visible?
Yes, sir. Yes,
Acha,
sir.
acha, okay. So we were talking about looking at ghost type, a predisposing factor we have seen, complications we have seen. Please mute your calls. Please mute your calls. Please mute your calls. Once again, team. So immunization schedule, this we have seen. Okay. Home atmosphere also we have seen. Okay. Occupational actually it is not working. Again, there seems to be some problem. 1 second. Okay. Once again, team. One second. Team, is it visible? Team, is it visible?
Yes, sir.
What is visible? Can you tell? Because I'm not able to see.
Case
Open
study
from
from
sessions.
Case study. Yeah. So the case study format, it is not opening. Okay. I will set it right and I will share the case study format tomorrow in the groups. So first we will take the presenting complaints to the of the client, and we will take the how whether any psychotic problem was within the family, that we will take. Then we will take the educational qualification of the client. Then is there any problem during her childhood? All these aspects we will be taking in appropriate cases. Here it is not required. Then we will be coming to her mental status examination. After taking the complete mental status examination, intervention. So in this case, intervention, there are total 5 sessions. Okay. So in the first session, usually CBT, that is the exposure and response prevention system, is very much useful. In the first session, what we will do is, the first session, we will do the rapport building. After rapport building, we will try to identify the issue. After identifying the issue, setting the agenda for the total sessions. For example, there are total 5 sessions. In these 5 sessions, we will be having CBT as well as hypnotherapy. This we will intimate the client that we will fix the agenda for the total days, and also for the each day when we start, we will start it with an agenda. So first day, we will psycho-educate the client about obsessions and compulsions, and also we will psycho-educate about OCD. That is, as far as CBT is concerned, psycho-education of CBT is very much essential. So 3 aspects will be psycho-educated. So can anybody tell what are the things will be psycho-educated in CBT? Can anybody share? Yes, team. What are the 3 aspects from CBT will be psycho-educated to the client, whether it is OCD, PTSD, whatever may be the problem? What are the 3 aspects will be psycho-educated? Team, is it audible?
Yes, sir.
Yes, sir.
Yeah, because I'm not able to. There is some technical glitch. I'm not able to see you people, so that I'm asking again and again. Anyone who has attended the internship, can you kindly reply? What are the 3 things we will psycho-educate the client in CBT?
Sir, automatic thoughts.
Yeah. See, in CBT, we will
Cognitive triad.
cognitive triad. Yes. Then
Normal basic cognitive model, sir.
yes. Can you tell what is the
Cross-sectional formulation.
yeah? All the 3. Can you just briefly explain, Ashwini?
Yes, sir. In the negative cognitive triad, we talk about like what is the thought pattern about myself and the world and the future of myself. So it's maybe the thought could be negative in
myself, like I'm not worthy, like that, and I can't do anything properly. Um, so
Yeah,
this
you
is
can.
our
Yeah, you can just explain the model. Yeah.
and I just have negative thoughts about the world, and also I have the negative thought about the future as well.
Yeah. So this is called a negative cognitive triad. Then we will be psychoeducating the client about the cross-sectional model and also the basic CBT model, that is situation doesn't create a reaction, but the thought creates a reaction. These three things we will psychoeducate the client. After psychoeducating the client, we will train the client in 1 minute mindfulness so that the client will be able to stay in the what you call parasympathetic nerve system, and she will be able to stay with awareness. So in the first session, psychoeducating CBT, training the client on 1 minute mindfulness, and also grounding techniques. Then we will use socratic questioning to uh, uh, to make the client understand the automatic negative thought or the intrusive thought. This we will do it in the first session. Then we will do the summary. We will train the client on thought record sheet. We will write one thought record sheet and show the client that this is how you have to do it in the home. Then summary, we will give the summary. Then we will discuss about the action plan which they have to do it in the home. Then the client will give the feedback. First session is over. In the second session, CBT response and response therapy will be used. So in the second session, we will again try to see. Again, we will see the thought record sheet which the client has written. Once again. So in the second session, we will. So in the second session, we will try to see the thought record sheet which the client has written. Then we will start with exposure and response aspect. That is, exposure is suppose, for example, somebody is touching you. Immediately, what is the feel you get? You feel like go and washing the hands. Okay, that is the response. The response is 10 times. The response, we will try to reduce it to 6 because the exposure will be done, then the response will be gradually reduced from 9 to 8, 8 to 6, 6 to 7, 6 to 5, 5 to 4, 4 to 3, like that. For that, we will do the exposure therapy and also visualizing exposure therapy. That is, first we will try to conduct this in the visualization. The client will visualize, and the client will tell that, okay, I have the capability to handle myself, and they will try to wash only 3 times and they will come out. So uh, we will try to train the client on exposure and retention therapy. Then we will train the client on systematic mindfulness exercise, and we will ask the client to practice it in their home along with thought record sheet, 1 minute mindfulness, and the other aspects. We will also ask the client to uh, practice the exposure and the response theory. And what is that they have to practice, we will completely guide. In the third session, we can introduce REBT. In REBT, we can tell the client that the client is having the irrational belief that I should wash my hand, otherwise I will get corona. So this is, we have to tell that this is an irrational belief, and this irrational belief will be, we can question using A, B, C, D, E. A stands for activating event, B stands for irrational belief, C stands for consequence, D stands for dispute, E stands for empower. So we will dispute the irrational behavior, and then we will try to empower the client with a new belief. In the fifth session, we can do hypnotherapy. So in the hypnotherapy, One second. Is it visible, team?
Yes, sir.
One second. Is it visible now?
Yes.
Is it visible now?
Yes, sir.
Yeah. So this is what we will do in the first session. This is what we will do in the second session. That is a CBT exposure and response therapy. In the third session, we will be doing identifying and challenging the irrational belief. Okay. In the third session. In the fourth session, we can combine a CBT and REBT, and we can strengthen the insight and relapse prevention. And in the fifth session, we can give the hypnotherapy. In hypnotherapy, we can tell the client about what is hypnotherapy. We can take the client to the trance. After taking the client to the trance, this is the induction phase. In induction phase, what is that we will do? And what is the therapeutic suggestion which we can give during the intervention period after the client goes to the trance. So that is available here. Then we will be doing the visualizations to strengthen the suggestion. Then we will awaken them, slowly awaken them. And this is what the 5 sessions which we will do. And I will do one thing. Actually, because of the system has crashed, the case study system has crashed. Because of that, I am not able to give the lively. I am not able to explain it. Maybe I will share the aspects tomorrow morning. Thank you very much for the 51 people for staying even now. Tomorrow in the group we will share whatever I have written now, and also the case study aspects, whatever we have written, that we will share to you. Okay. So thank you very much,
Sure, sir.
team, for joining. We have our diploma, 8 months diploma have started. Whoever wants to join our 8 months diploma, they can join. 8 months diploma, we will completely cover 40 therapies. Practically, we will cover each and every aspect will be practical. The 8 months program have started with hypnotherapy. Whoever wants to join, they can join immediately, so that they can start practicing hypnotherapy in another 10 days. In another 10 days, people can start practicing hypnotherapy. After hypnotherapy, they'll be learning CBT or EBT, like that. All the 40 therapies we will be learning. The PDF along with the questionnaires and also the case study format, I will be sharing to you people tomorrow morning. Okay. Thank you very much. Bye bye.